52, 53, 73 and 74 modifiers are the most misunderstood modifiers in surgery coding. Sometimes these are very confusing as these modifiers differ from facility coding to physician coding. So in this session, we will see which modifiers we will use in physician coding and which modifiers we will use in facility coding. Basically, among modifiers 52, 53, 73, 74, we will use 52 and 53 modifiers for physician coding or physician service. 73 and 75, 73 and 74 for facility coding. Okay. So in today's session, we will see introduction to terms like what is reduced service, what is discontinued procedure, and what is cancelled procedure. Next, we will see professional modifiers with example and facility modifiers with example, and we will see few additional insights and tips related to usage of these modifiers. So if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is the description of this video. And also if anyone looking for same-day surgery tutoring training, SCC training, CCS certification training, please send message to 707-526-3939. First we need to understand reduced surgical procedure. Okay, so what is a reduced surgical procedure? Here, service or procedure is less extensive than typically described by the full CPT code. Okay, so most common example is tonsillectomy. Okay, basically if the patient performs tonsillectomy on both sides, we need to use 42825. So defaultly, patient needs to perform both left side as well as right side tonsil excision in 42825. Okay, but if the patient performs this tonsillectomy on only one side, so that time we will use this 52 modifier, or we will use this reduced service procedure. For reduced service, we will use 52 modifier. Next we have failed and unsuccessful procedures. Okay, so here physician will attempt the procedure, but physician will not get the desired result. So that time we will use failed and unsuccessful procedures. So most common examples are physician will perform the external cephalic version if the baby is in the breech presentation. But even though physician will perform external cephalic version multiple times, still baby is in the breech position. So that time we need to use failed and unsuccessful procedure modifier. Even though patient is in the breech position, we need to use complete CPT code here. Why means here physician has provided the service and incurred work and risk. So what is the important concept here? Whenever physician will perform the procedure and if the physician is unable to get the desired result, we need to use the complete CPT code. We will not use any modifier along with failed and unsuccessful procedure. Next we have terminated, discontinued or aborted procedure. So basically these are intentional termination, discontinuation or abortion or aborted procedure. So sometimes because of patient's extenuating circumstances, physician will stop the procedure. So that time we will follow these guidelines. Now we will see professional modifiers. So basically we have two modifiers for professional service for reduced service. 52 modifier reduced services, 53 modifier discontinued procedure. So reduced service means here physician has performed the procedure, but it is not extensive than the CPT code description provides. Next one is 53 discontinued procedure. Here physician has started the procedure, but he will not complete the procedure because of patient's condition or any type of technical difficulty. So we will see one example for 52 modifier. So here patient came in for left tonsil excision as patient had previous right tonsil excision in 2021. Okay. So as we have discussed previously, here physician has performed excision of only left tonsil as patient does not have right tonsil now. So based on the CPT code description, we need to use 42825 if the physician performs complete excision of tonsil, right and left. But here in our scenario, patient has performed only left tonsil excision. So which modifier we will use here? So this is the example for professional services. Okay. So here we will use 52 modifier, which is a reduced service. Here our answer is 42825 52 modifier. Why means here patient has reduced the service and he performed tonsillectomy on only left side, not on the right side. If the patient performs both right and left, which modifier we will use? Please mention in the comment section of this video. And also if you use the modifier or not. Next we will see facility modifiers. Okay, so 52 and 53 are for professional modifiers, were reduced service as well as discontinued procedure. In the facility setting, we have 73 and 74 modifier. So 73 modifier is for discontinued procedure before the anesthesia, 74 modifier for discontinued procedure after the anesthesia. So in the facility setting, if the physician reduces the service, we will not use any modifier. So we need to use complete code. For example, physician is performing same tonsillectomy in facility setting. So that time, if the patient performs only left tonsillectomy, we need to use 42825. We will not use any 52 modifier in the facility setting, as 52 modifier is exclusively related to physician coding. So here we have few more examples related to this concept. So what are the keywords to check in order to append 73 and 74 modifier? So the procedure was planned and are started. We need to check in the documentation. So the procedure was cancelled or discontinued. Okay. So the procedure was completed but desired results were not achieved. So that time we will not use any modifier basically, but we need to check the documentation. Okay. So the procedure was cancelled or discontinued before or after the administration of anesthesia. So as we have discussed previously, if it is before anesthesia, which modifier we will use? Please mention in the comment section. If it is after anesthesia in the facility setting, which modifier we will use? Please mention in the comment section. So these are the common example for these modifiers. So here, physician has performed unicompartmental knee arthroplasty to a total knee arthroplasty. In the facility setting, we will not use any 52 modifier. Why means 52 modifier is exclusively for physician coding or professional coding, not for facility coding. Okay, so directly can code here 27487. So here we have few more examples related to colonoscopy. Okay, so whenever you code colonoscopy, you need to check what extent the scope is entered. So based on that, you need to follow these guidelines. So how do you code? If the patient performs multiple procedures, among those one procedure is reduced. Okay. So basically, if the patient perform multiple and few discontinued procedures in these multiple procedures, no procedures performed. Okay. So report primary procedure with modifier 73 or 74 based on anesthesia status. One completed, second started but not finished. For first procedure, we will not use any modifier. For second procedure, based on anesthesia, we need to use 73 or 74. Okay. We will use 73 modifier once per encounter. If the patient discontinues the bilateral procedure, report one side with modifier 73. Do not use modifier 50. So these are the common examples for this facility setting. So here, which code we will use? Here patient is having reducible inguinal hernia. So prior to general anesthesia. So this is the keyword for 73 modifier. Okay, here we will use 4952073. So if you see here, we will use 5235674 modifier. So what is our keyword here? So after confirming adequate anesthesia, the patient was prepped and raped in a sterile fashion. Means patient has administered the anesthesia. So this is the keyword. Multiple attempts were made to carefully navigate the scope past the stricture, but due to persistent resistance and increased risk of trauma or perforation, the decision was made to abort the procedure. Okay. So basically here, after the anesthesia, patient has aborted the procedure. So here we need to use 5235674. So which is for cystourethroScopy with lithotripsy and ureteral stent placement. So reimbursement specific. If you append 52 modifier, patient will get 50% amount or reimbursement. If you append 53 modifier, payment reduction is based on the percentage of procedure completed. If you append 73 modifier, 50% reduction in the payment to facility. So if you append 74 modifier, so there is no reduction in the procedure to facility. So thank you guys. If you like this session, please click on like button.